Hello, my name is Anthony Robinson. This presentation shares my applied project titled SBIRT Referral, Quality Improvement, and Motivational Interviewing-Based Brief Interventions. Let's begin with a brief overview of the project and its aims. The evidence-based intervention, or EBI, used in this project combines screening, brief intervention, and referral to treatment, abbreviated as SBIRT, with motivational interviewing, or MI. The purpose is to improve screening and referral rates among hospitalized cardiology patients who also have substance use conditions. The goal is a 20% increase in both screening completion and referral follow-through within 6 months. This project is currently in the early implementation phase corresponding to stages 4 and 5 of the SIC, or Stages of Implementation Completion Framework. Both SBIRT and MI are well supported in the literature as effective approaches for reducing risky substance use and promoting patient engagement. This project takes place at Inova Fairfax Hospital, located in Falls Church, Virginia, within the cardiology department. It involves collaboration with the Comprehensive Addiction Treatment Services, also called the CATS team. Key stakeholders include Dr. Zena Saliba, the Physician Director of Addiction Medicine, Jacqueline Ross, Registered Nurse Director of the CATS Consult Service, and Ashley McDougall, Licensed Clinical Social Worker and CATS Therapist. These leaders provide medical, nursing, and behavioral health perspectives essential to implementing integrated care. The CFIR framework, short for Consolidated Framework for Implementation Research, was used to assess the setting's culture, readiness for change, and leadership engagement. Through stakeholder interviews and analysis using the CFIR framework, 2 top barriers were identified. First, staff workload and competing clinical demands, which often lead to delayed or skipped screenings. Second, limited physician engagement in completing SBIRT documentation and referrals. Key facilitators include strong executive support, nursing leadership, and the addition of SBIRT prompts within the Epic electronic health record system. To address these barriers, ERIC strategies, short for expert recommendations for implementing change, were applied, including educational outreach, audit and feedback, and workflow mapping. This logic model connects inputs, activities, and outcomes for the project. Inputs include leadership commitment, MI training, and EHR enhancements. Activities involve staff training sessions, use of Epic smart phrases for screening, and bi-weekly data audits. Outputs are improved screening accuracy, and workflow consistency. Short-term outcomes include a 25% increase in screening and a 20% increase in referral completion. Long-term outcomes focus on reducing readmission rates and improving cardiovascular health for patients with co-occurring substance use conditions. The implementation plan follows 3 structured phases. Phase 1, lasting months 1 and 2, included staff training and development of protected time for screenings. Phase 2, covering months 3 and 4, integrated SBIRT prompts into Epic and initiated weekly data review maintenance. Phase 3, during months 5 and 6, engaged payer representatives and case managers to address referral barriers and strengthen warm handoffs. Implementation used both the Lean Plan Do Study Act, or PDSA, cycle and the ERIC strategies of educational meetings and continuous audit feedback loops. The implementation process was guided by the Stages of Implementation Completion Framework, or SIC. This model tracks progress across 8 stages, from initial engagement through sustainability. Currently, the project is in stages 4 and 5, focusing on training, fidelity preparation, and initial delivery. Fidelity is being measured through the Motivational Interviewing Treatment Integrity Tool, abbreviated as MITI, with a goal of achieving average fidelity scores above 3.5. The process also integrates the Lean and PDSA frameworks for continuous quality improvement. The evaluation strategy is guided by the RE-AIM framework: reach, effectiveness, adoption, implementation, and maintenance. Key evaluation questions include: did screening rates increase by 25%? Did referral completion rise by 20%? And were fidelity levels maintained above 3.5? Quantitative data are drawn from Epic system reports, referral logs, and MIDI fidelity assessments. These outcomes are appropriate for the project's early implementation phase where feasibility and consistency are the primary focus. For sustained implementation, I recommend that the Inova Behavioral Health Leadership and the Regional SBIRT Collaborative serve as purveyors, responsible for ongoing training and fidelity oversight. The project uses a hybrid Type 2 design, blending implementation and effectiveness evaluation. Data collection occurs quarterly through Epic dashboards, MIDI ratings, and staff satisfaction surveys. This ensures continuous feedback and supports system-wide scale-up across other Inova hospitals. In summary, integrating SBIRT and motivational interviewing within cardiology care improves screening completion, referral documentation, and staff engagement. Facilitators such as leadership support and EHR integration played critical roles. Next steps include maintaining quarterly fidelity audits, expanding the model to other hospital units, and continuing staff booster training sessions. These strategies ensure that gains achieved in the early implementation phase are sustained and scaled across the organization. All references are formatted in APA 7th edition style. They include foundational works by Babur, Corso, Saldana, Wong, and Najavitz, as well as recent literature on integrated behavioral health and quality improvement frameworks. Full citations are available on this slide for review. Thank you for your time and attention. If you'd like to discuss this project further, please contact me at arobin2@asu.edu. I'd like to express special thanks to the Inova Fairfax Cardiology and CATS teams for their collaboration and continued commitment to behavioral health integration.